Toxic masculinity is a side effect of low testosterone. Low testosterone is such a prevalent issue. We're left with is men who they want to be men, and yet they can't. And it makes them sad, and then it makes them angry, and then it makes them toxic. I don't want men to have to wait until they get to that position for us as medical providers to say, you know what, maybe now's a good time to start testosterone replacement therapy. The foundation of that pyramid, you got to have good hormones. You do. It's a requirement for life, for development, both physically, mentally, emotionally, and frankly, spiritually. You have to have the proper hormones to drive this train. For men, if you are lacking androgens, specifically testosterone, let's just call it the king of androgens for a moment in a lot of ways, well, then how in the world are you supposed to drive this train that well? How are you supposed to ever escape those maybe bottom few layers of the pyramid? Most guys don't. And then they start self-medicating, right? Either they pursue it, but just in the wrong way, right? They start using things like anabolic steroids and stuff. I mean, I really mean that. I think if those guys probably had really healthy testosterone levels early on, they probably might not have gone in that direction. Again, there are bodybuilders and stuff who they want to do that for a living, but like a lot of guys are doing it because they're self-medicating. By the way, the opposite direction, and I think they're both kind of in the same position of like, this isn't good for your health. Of course, the opposite direction is, well, I'm just going to numb myself. I'll drink myself to death. I'll smoke myself to death. I'll do drugs. I'll have terrible jobs. And then I'll have very reactive relationships and a lot of turmoil and ups and downs and lefts and rights, right? Maybe I feel so depressed that I start taking antidepressants because I don't know what's wrong with me. And maybe I'm trying to get help. And of course, my medical provider, doctor, nurse practitioner, physician says, I don't care. They tell me the same thing over and over again. I don't know what's wrong. Everything looks fine. Your blood works great. Sure, you're a little overweight. Sure, you're sad. Here's an antidepressant. And I think that is such a travesty. I think it's such a travesty because we know that low testosterone is such a prevalent issue. I mean, it's a literal epidemic. I'd venture to almost call it a pandemic because seriously, I think almost worldwide, it's that big of an issue. And I've talked about it 1,000 times. A lot of it has to do with the environment. A lot of it has to do with personal choices too. And a lot of it has to do with just what we're dealing with, right? I mean, if our mothers were pumped full of plastic byproduct chemicals, to their knowledge or not to their knowledge, well, it's going to impact the function and the development of the testes, the Leydig cells. They're not going to produce as much testosterone. So what we're left with is men who they want to be men. They want to be that vision in their head of what they know to be a man, and yet they can't. And it makes them upset, and it makes them sad, and then it makes them angry, and then it makes them toxic. Okay? Toxic masculinity is seriously, in my humble opinion, a side effect of low testosterone. And to like the nth degree, right? That's what it is. I mean, seriously, if you've ever met a toxic male figure, like, and I'm not talking, by the way, about like personality disorder stuff. Like I'm talking about just like a guy who just can't seem to get it right. It's probably because he has low testosterone. Because now they're estrogenic mostly, which makes them highly reactive. It's extremely stimulating, not in a good way. It's pumping a bunch of cortisol in. It's getting our prolactin levels up, which makes us even more moody and bitchy and miserable. And so the antidote, in my humble opinion, again, is very obvious: testosterone replacement therapy. And so again, we can talk about how testosterone replacement therapy increases lean muscle mass and improves brain fog and blah 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 blah. I love all those things. Like those are the cherries on top of what testosterone replacement therapy is actually doing, which is ultimately driving energy, the currency of life, at a cellular level, helping that foundational position of the pyramid, the Maslow's hierarchy of needs, helping to fulfill that so we can now start really climbing those pyramid steps up to the top. That's why we give testosterone replacement therapy. Seriously, at the very, very bottom of it all is how much energy can we continue to produce to allow ourselves at a cellular level and then at a tissue level and beyond that as a whole organism to not only survive but truly thrive in practically just about any environment you can think of. Because we see men all across the world in every inch of it, right? And so I think that is what testosterone replacement therapy is for. And I think it's a damn shame if we do not take a moment to consider how can we optimize testosterone replacement therapy more and more and more and more. How can we get more guys on this stuff? And so now we start having to have this conversation of, okay, so in my head, it was only for guys, above the age of 40. They've already had kids. They're feeling like total dog shit now. I mean, they've been feeling like crap for 20 years, but now they look awful. They're overweight. They've got fatty liver. They've probably got a little bit of prediabetes. They're totally unmotivated to do anything. Their libido's terrible, blah, 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 blah. Their wives complain about them. I don't want men anymore to have to wait until they get to that position for us as medical providers to say, you know what, maybe now's a good time to start testosterone replacement therapy. And I want to specify why. Okay. So first and foremost, does testosterone replacement therapy cause complete and utter permanent sterility? No, it does not. I want to clarify this, okay? This is a huge misnomer and frankly, kind of a double standard that we see. Testosterone replacement therapy is it's not the same, but I'm going to make a very broad comparison. It's like female birth control. Does female birth control cause complete and utter sterility permanently of the female? Of course not. I'm talking about hormonal birth control like oral contraceptives, okay? Oral hormonal birth controls. As an obvious example. If a female takes that, it completely shuts down their system, their hormones. They don't really produce any. So their body just practically completely shuts down. They don't ovulate, and so they can't get pregnant. If they stop taking birth control, does it go back to where they were? Yeah, basically. Now, there's a little more nuance there. And I talk about it in the master course because I'm not a big fan of birth control at all, especially the hormonal stuff. It's terrible for women. And I have a whole podcast about that, so you can listen to that one. But needless to say, if we overgeneralize here, yes, you stop birth control, you go right back to where you were, you start bleeding and you start having a cycle and blah, blah, blah. Everything's fine. Well, guess what? The same is true for testosterone replacement therapy. It is. We've done studies on this, guys. There's this idea that somehow testosterone replacement therapy, you start taking it, will it cause testicular atrophy? Yeah, absolutely. Does it shrink your testicles up? Of course it does. It's shutting down your brain and your testicle connection, right? The HPG axis. It does have a negative effect there. Now, again, is that a bad thing? No. In fact, in all the studies that we've ever looked at, when men are on testosterone replacement therapy, their all-cause mortality goes down, their risk of diabetes goes down, they don't have as much cardiovascular disease issues, blah, 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 blah. All the amazing things happen. So it's not a bad thing. Does it cause testicular atrophy and a decrease in semen production and spermatogenesis specifically? Does it stop spermatogenesis, the production of sperm? Yes, it does. Now, even to that effect, let me just clarify. It is not always zero. Like there are men who are on testosterone replacement therapy and have gotten women pregnant. Okay. So it's not birth control either. And in fact, there are studies that have looked at, can we use testosterone replacement therapy as birth control? And the answer was like, you might not want to do that. It's not that effective. Nonetheless, while you are on testosterone replacement therapy, does it essentially cause a decrease in spermatogenesis and a what I would call very temporary sterility? Sure, but it is not permanent. When if you put a male on testosterone replacement therapy and he takes it for months, years, whatever, and then you tell that guy to stop taking testosterone, in the studies, The vast majority of men within 12 months have complete and total restoration of spermatogenesis and their own endogenous testosterone production. Yeah. So a lot longer of a period of time than women coming off of birth control. They're like back in shape in 3 to 6 months tops. By the way, some men within 3 to 6 months, they're in totally a good place too. There are some men that go even a little bit further, maybe getting closer to 18, 24 months. Nonetheless, it is not permanent in any way, shape, or form. Now, if a guy coming to you already, whether you know it or not, has issues with spermatogenesis, testosterone is not going to make it better, but it's not necessarily going to make it worse either. It's just going to be the same. So we have to stop. We have to stop coming up with this idea in our head that testosterone replacement therapy equals bad for young men in particular, or men of fertile age and trying to have kids. We have to, because it's not helpful. What we end up with is men in the prime of their lives who are miserable. They're those toxic men. They're reactive. They are lack of motivation, depressed. They're anxious. They're miserable to be in with a relationship. They're not really good fathers. And by the way, I was kind of one of those guys too. I'm not like disparaging these men. I really was. I feel like I was in that position. And I think my wife would tell you the same thing, frankly. I wasn't a bad guy. I was just emotional and reactive all the time about everything because my testosterone was just so crap. And I just wanted to be a man. I wanted to be brave and I wanted to be strong and I wanted to be, protective of my family. I wanted to have that vision and purpose and drive to go out and do things, to be helpful. And man, oh man, when I started testosterone replacement therapy, my entire world changed. I have a whole episode on that. I think early on that I did. If you ever want to go back and listen to my own story, but I'll stop belaboring the point there. What I want you to know is that we have to stop putting testosterone replacement therapy in this weird box, which is like only for men over the age of 45 and up. It's crazy. It's totally crazy. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.